today to talk to us about the Parkrun that he has implemented within his forensic unit. And he's the Associate Director of Social Work at Lancashire and South Cumbria NHS Foundation Trust. That's a beautiful part of the country, that. Bringing over 15 years of experience across adult and children's services in both community and inpatient settings. So since qualifying with a Master's in Social Work, Mike has held a range of frontline and leadership roles, including as an approved mental health professional and manager of the Lancashire and South Cumbria Forensic Community Mental Health Team. So Mike served in senior operational positions across the organisation, contributing to service development and transformation. And he is a member of the Chartered Management Institute and has recently completed the Senior Leadership MSc at Lancaster University. Hey, Mike, you feel like an eternal professional development student. So is PhD on the next line of things for you? I don't know how many more masters you could have.
Possibly, yeah, it's in the pipeline, maybe.
Yeah, that's a good one to go for. So Mike is a passionate advocate for the profession, and he's committed to ensuring social work plays a central role in helping the NHS meet current and future health challenges. He's the founder and event director of Guild Parkrun, the first NHS-initiated parkrun, and the first to be hosted within a secure mental health facility, which demonstrates his initiative approach to community engagement and mental health recovery. Well, I'm really excited to hear about this. I know my former boss, Ian Maidment, told me about you, Mike, so I'm assuming that you know each other. And I thought, wow, that sounds great. Sounds like a good topic for us to have here on the Mental Health Improvement and Innovation Network. So I'll give it over to you and we can take it from there.
Yeah, thank you, Joe, and good afternoon, everyone. Thank you for attending. So the presentation provides an overview of Guild Parkrun, findings from an evaluation that I've undertaken into it, and then how I've used the evaluation to enact further changes within the initiative. So Lancashire and South Cumbria NHS Foundation Trust, which is abbreviated to LSCFT throughout the presentation, supplies a range of mental health and physical health services to address many of the health and wellbeing needs for the population of Lancashire and South Cumbria. Guild Lodge, one of the services provided by LSCFT, is a secure mental health hospital providing low and medium levels of security for both men and women. The hospital has 164 beds and it's located in the grounds of Guild Park on the outskirts of Preston in Lancashire. So the map represents the full geographical area of where LSCFT provides services, and Guild Lodge, Guild Park is approximately here on the slide. There's also an attached forensic community service, which is based on site with a caseload of around 100 service users, and they tend to be discharged around the full geographical footprint, both South Cumbria and Lancashire. Guild Parkrun is a closed event that is not accessible to the general public without pre-authorization, where residents require a level of safeguarding and anonymous participation records. And closed events take place nationally at over 25 prisons and young offenders institutions around the country. So as Joe had said, I'm the co-creator for Guild Parkrun and the project manager. I won't go over my bio because Joe's mentioned that, but at the point of inception of the project, I was the manager for the Forensic Community Service at Guild Lodge. And while the project has progressed and grown, I've then been promoted to my current post as Associate Director of Social Work at the Trust. So this slide is a map of all of the adult parkruns across Lancashire and South Cumbria. This G here again represents the approximate location of Guild Lodge. So there's lots of adult mainstream parkrun events across Lancashire and South Cumbria, but unfortunately they are not that accessible for service users who are detained at Guild Lodge. So the nearest parkrun to Guild Lodge is the Avon Parkrun in Preston, which is an open access event. It's around an hour by public transport, so any service users who would like to attend that on a Saturday morning would need to get the 6:47 bus in order to be able to make the start, which makes it unacceptable, inaccessible even for service users who are based at Guild to be able to make that. So for those that don't know what Parkrun is, so Parkrun's a global charity that delivers free volunteer-led weekly 5 kilometre events and 2.5 kilometre events for children only. It prides itself on an ethos of inclusivity that encourages communal physical activity. It started in London in 2004, and since then, over 100 million people have taken part globally. Events take place across 22 countries on 4 continents with over 2,000 different events globally each week, and around 500,000 people take part globally each week. Some of the slogans of Parkrun are that there's no winners, only first finishers, and no one ever comes last. A volunteer takes that role, tail walking after the last participant finishes each week. The aim is to help people feel good and enjoy time outside with others to support their health and happier lifestyles. And research, there's a lot of research that has been done into Parkrun. Research has shown that Parkrun significantly benefits participants' health, well-being and social inclusion. And that's both people who take part running or walking, or even attending in wheelchairs, and also volunteers who attend to support the event. The rationale for Guild Parkrun. So it's well established that physical activity benefits both physical and mental health, and they're an essential component of recovery and prevention of mental illness. However, people with mental health conditions are disproportionately excluded from taking part in mainstream physical activities, facing a multitude of social, financial and physical barriers to being active. And they're some of the most inactive groups within our society. People detained in secure mental health hospitals often have limited physical exercise opportunities, which leads to sedentary lifestyles and weight gain. Obesity rates in these settings can reach up to 80%, which contributes to a range of life-limiting diseases. And physical inactivity is associated with 1 in 6 deaths in the UK. And in terms of financial costs, it costs the economy over £8.2 billion per year. So in 2024, while I was manager of the Forensic Community Service, I completed a needs analysis of the entire caseload. So that was those discharged from Guild Lodge into the community who were being supported by the Forensic Community Service at that time. And it found that just under half of those service users out in the community do not engage in regular exercise or sport outside of the home at least once a week. Only half engage in leisure or hobbies outside the home at least once a week. Only half have regular social activity outside the home at least once a week. And this data is then used to inform the decisions about the relevance and the need to set up Guild Parkrun for service users at Guild Lodge. At the same time, and despite knowing the benefits of physical activity, many healthcare professionals are not active enough. Obesity, stress, anxiety are at an all-time high among our workforce, and especially our nursing workforce. Sickness absence rates in the NHS have increased since 2009, which impacts on service delivery, inpatient care and costs, and it can contribute to staff shortages. So NHS employees have around double the rate of sickness absence of the UK workforce as a whole. And it's been found that workplace physical activity programs can reduce absenteeism by up to 20%. Physically active workers take around 30% fewer sick days than their colleagues. They're more productive at work, they have a higher quality of life, and they are more likely to enjoy the work. So the photo, some of you may recognise it, is from the film Field of Dreams, which had the famous line, "Build it and they will come." So the idea for Guild Parkrun sparked from a chance conversation I had with a Parkrun ambassador at the conference. So I'd shared how I'd transformed our staff football team into a running club during the COVID-19 pandemic to continue physical activity and to support the physical and mental health of staff. And I also discussed my passion for running. The idea of enabling access to a local parkrun to provide regular social and physical exercise opportunities for some of the most disadvantaged and disempowered people in our society, as well as benefiting the physical and mental health of staff, was massively appealing. So the project had a clear agenda to initiate an LSCFT Guild Parkrun for inpatient mental health service users and staff. The aims of the project were, number one, to launch a sustainable Guild Parkrun for LSCFT service users and staff. Number two was to determine the impact of Guild Parkrun for service users and staff participants, walking, running or volunteering. And the third was to determine the impact of Guild Parkrun for the organisation. So the project adopted a cyclical action research approach. So for those that don't know, action research is a similar approach to the Plan, Do, Study, Act model, which is widely used across the NHS as an improvement approach. However, action research is regarded as more empirically grounded, can involve multiple spirals of cycles, and brings together research and practice. So research informs practice and practice informs research synergistically. The approach enabled me to undertake practitioner research, critically analysing and integrating information, which supported the development of the project. 2 evaluations were developed in collaboration with the core team, an expert by experience, and supported by the LSCFT research team. The first evaluation was completed by all attendees at the launch event, and the second was completed by attendees at following events over the following 6 months. The 2 evaluations generated both qualitative and quantitative data, and the LSCFT research team then supported the analysis of this data, which generated the findings, which will be discussed shortly. The diagram on the slide represents the 3 action research cycles that were undertaken during the project. The second spiral was completely unplanned and relates to the withdrawal of landowner permission, which I'll talk about further when discussing some of the challenges of the project. So these were our achievements. So we launched the event on the 13th of July, 2024. And when we launched, we were the first NHS Trust initiated parkrun, and we were the first secure mental health parkrun globally. Our outcomes. So in relation to goal 1, we achieved our first goal to launch a sustainable Guild Parkrun for LSCFT service users and staff. So far we have had 60 events. We've had 322 finishes. There's been 53 personal best times set on the course. The attendees have covered over 1.6 million meters, which Google informs me is the distance between London and Rome approximately. And we've had 57 volunteers supporting the event. The photograph on the slide is of the Guild core leadership team at the launch event. So in relation to goal 2, to determine the impact of Guild Parkrun for service users and staff participants. So we achieved this. So the first evaluation found that 100% of the attendees enjoyed the launch event. And then both evaluations have found that through thematic analysis and analysis of the quality of the data, there's been 3 overarching themes. Those themes are motivational benefits, environmental benefits, and social and relational benefits. So around 90% of attendees have experienced an improvement in social and relational benefits. Around half of attendees have experienced an improvement in mental health, even. Around half have experienced an increase in the motivation, and around 2 in 5 have experienced improvement in the physical health, and they are a result of attending Guild Parkrun. Some of the quotes and feedback includes people enjoying being out in the open, in nature, which stimulates them because nature is powerful on the mind. Having a sense of belonging and a feeling of togetherness, and then a genuine example of trying to break down the barriers that exist with our services and the people that utilise them. It's an inspiration for how things could be. The greatest overall impact was reported for attendees' social and relational benefits, and the feedback from both staff and service users was about the relationship-based effects of attending Guild Parkrun. So some spoke about Guild Parkrun impacting on the hierarchies that exist within our services. So staff and service users, which is a significant institutional barrier, especially within secure services. So it's supporting forming therapeutic relationships. They also spoke about Parkrun being a great leveler. So everyone attending had the same goal, and those interactions that they had, whether they were staff or whether they were service users, were the same regardless of who they were. Some spoke about the organisational benefits, so such as interacting with and forming relationships with staff in different departments and at different levels of the organisation. For example, one of our execs is the other event director and regularly attends, and we've got other senior managers who attend as well. So what Guild Parkrun brings is an environment that the ability for staff at different levels of the organisation to be able to interact. Some staff have then gone on and ran together outside of work and attended other parkruns together. And therefore there's clear evidence of that it's enhanced networks and supported social relationships, which otherwise wouldn't have existed. And then in my own experience, so I was registered with Parkrun since I think about 2008, 2010, but I'd never actually run. I've now volunteered on over 70 occasions. I've completed over 33 park runs, 6 at Guild, and so I'm well and truly part of the cult. And I've drawn my wife into that and my children as well. So I often attend other events, not Guild, other mainstream events with my wife and children, who are in primary school. My wife's a primary school teacher, and so she's then drawn her head teacher and other teachers within school into it, and we're actually all attending a mainstream event on tomorrow, on Saturday, together, and they're just in the process of joining the primary school parkrun initiative. So outcomes. So this is a case study around, a brief case study around V Brianna. So this is her Parkrun anonymized name. So she is a middle-aged female service user at Guild Lodge, has been there for several years. So far she's attended 42 Guild Parkrun events. She during that time she's lost over 3 stone in weight, and her 5k time has come down from 37 minutes, just over 37 minutes at the first event, to now she's running 25-minute PBs at Guild Parkrun, which isn't the easiest course because it does include a hill as well. So she's getting some really good times. But what we found is that was a hook, that the initiation of Guild Parkrun and her attending has been a hook to get her into running. So within a few weeks, she started running the Guild Parkrun course during the day, went out on leave, which is something obvious, but not something we thought about when we set it up. And now she's got on to take part in mainstream half marathons, and has recently completed a marathon as well. So it's expected that she'll be discharged from Guild Lodge in the coming weeks. And speaking to her, she already knows where she's being discharged, where the local park run is, and she plans to continue attending that every week when she's discharged. So this slide just demonstrates our trust for quadruple aims. So they are to improve health, provide the best possible care, provide value for money, and for our staff to have joy and pride in work. So this slide kind of outlines the achievement of goal 3. As you can see, Guild Parkrun has delivered across the 4 quadruple aims. We're just focusing on value for money. The costings there don't include some of the secondary financial gains, so around the improvement to mental health, the improvement to motivation, the improvement to physical health, of staff and service users. Also, the impact it's had on potentially reducing staff sickness rates, improved performance at work, and reducing harm incidents involving service users taking part. So some of the feedback that we've had from ward managers is that some of the service users who've attended, they've actually seen a reduction in the number of harm incidents or management difficulties that they've had with those service users on the ward. So in this regard, the project has challenged some of those existing assumptions that are out there about what's strategically possible, particularly from a volunteer-led model. So some of the challenges, that we faced setting up Guild Parkrun and ensuring that it's sustainable. So the first, as I mentioned earlier, was around landowner permission. So landowner permission is required to obtain a license to run the event as a parkrun. So we'd initially secured the landowner permission from Homes England, who manage most of the land around the Guild Park site. However, Homes England withdrew the license for use after 6 months. The event was stepped down for 2 weeks while we sourced an alternative route, and this was approved by Parkrun. So a new route was identified on exclusively LSCFT owned land, so the third party approval wasn't required. And we managed to get that approval and relaunched the event within 3 weeks of Homes England withdrawing the license. The next is around maintaining engagement. So while initial participation was really strong, in the following 15 months, maintaining attendance from volunteers, staff and service users has been a challenge. So the greatest number of attendees attended the first event, and then this has tailed off over time, which is what we expected. The volunteer numbers have dropped as we're asking for staff to regularly give up their own time to support volunteering at a weekend when a lot of them have got their own lives to get on with, and children and whatever other commitments that they've got. There's also the requirement to balance clinical responsibilities with the volunteer roles for those that are working, and attendance can be challenging because of that. Especially within a secure setting where staff availability may vary depending on what's going on around the site. Attendance can also be impacted by the status of the service users Section 17 leave arrangements, the staffing numbers available to support service users who require an escort to the event, the ward acuity, service users who have attended Guild Parkrun who have then been discharged. The time of year we've noticed can have a bearing. So as we move into winter, we expect the numbers to reduce further, and the weather, which is interlinked with that. And finally, stigma and public perception. So despite its therapeutic goals and it being held on LSCFT owned land, Guild Parkrun has faced some criticism and misunderstanding from the public, particularly the local public, around the idea of patients with serious mental health conditions participating in a community-based activity. We have attempted to address this both at individual and community level, but I think it has been a challenge and a shame as well that it reflects some of the lack of understanding about what we're trying to achieve, some of the clinical decision making that's been taking place within the process, and also about individuals' human rights, that individuals have a right to access physical activity exercises. So recommendations. So I've made 11 event-specific recommendations based on the evaluation findings, which have been developed in collaboration with key stakeholders and service users to enhance the event and grow service user and staff attendance. So this includes inclusivity and support. So ensuring that we're creating a welcoming environment. So we've also created walking only events and a buddy system, and de-emphasized competition, which some service users particularly found off-putting. So we had our first walking event on the 26th of April, and we keep pushing with service users and staff that they're able to attend and just walk. It's not, although it's called Parkrun, it's not just about running, it's about engaging in that communal physical activity outdoors in the fresh air. Celebration and recognition. We celebrate personal milestones and event milestones, and recognise staff volunteer contributions. Through our NHS charitable fund, I managed to secure some funding, so we were able to purchase the milestone merchandise that Parkrun sell for service users who achieve the various milestones, be that 25 events, 50 events, 100 events. So Brianna, the case study I provided before, she's been the first service user to achieve the 25 milestones, and we've purchased a T-shirt for her and presented it to her on the event anniversary. Community building. So we've encouraged internal takeover events and some friendly group competitions. So that's with it, staff groups within LSCFT. So far we've had 4 takeover events from our HR department, safeguarding team, our talking therapies team. I've come down and either volunteered or ran the event in a communal way. To incentivize and reward, so as well as milestone merchandise, to reward people who take part. So we've supported that through our internal awards system within the organisation. So Time to Shine awards, we've nominated people to be awarded for awards through that recognition system. The plan is to continue to reevaluate once the recommendations have been implemented to determine whether they've been successful or not. So further activity to sustain and enhance the project since it's launched. So a lot of it has been about sharing what we've done and the research findings. So this includes with you today. The findings have been shared internally within LSCFT and presented to our exec team. I've presented at the Joint Universities Social Work Association earlier in the year, and one of the aims is to grow this volunteer-led model. Similar volunteer-led approaches may support a more financially sustainable model for health and social care services to increase access to evidence-based opportunities for service users and staff. And it seems particularly relevant now, given that we've got increasing health and social care costs of an ageing population and acute staff shortages. And I'm in the process of exploring the development of other parkruns within the LSCFT footprint. So, for example, at the Harbour, which is our largest acute hospital within the trust, which is based in Blackpool. I've developed a strategic partnership with Moving Social Work, and we plan to hold a conference with attendees from the National Principal Social Work Network, with the intention again to share, influence and grow the project into more of a movement across organisational boundaries. In July, I was invited onto BBC Radio Lancashire and discussed Guild Parkrun with one of the presenters. And as I say, I've also presented at the Juswa conference, and in July as well, BASWA, the British Association for Social Work, published an article about Guild Parkrun. Finally, we've shared the project with NHS England, and I've explored setting up other parkruns with other organisations. So one example would be to have a regional high secure parkrun, and if that was successful, we could then develop a parkrun pathway for our service users to run, walk or volunteer from high secure services all the way through to medium and low secure services at Guild Lodge, and then finally all the way through to mainstream events in the community when they are eventually discharged. That's the final slide. So thank you for taking the time to listen to my presentation, and my details, my email address is on the slide. Happy for anyone to email me if you've got any questions, or you're watching this presentation outside of this meeting now. By all means, just email me. Does anyone have any questions?
Oh, Mike, that was great. So thanks very much, everyone. If you've got your virtual hands, you can give some claps here, or you can give real ones, because I'm usually rubbish at trying to find the right virtual button to click there. But thank you very much. My mind was like sparking off in so many different directions. And if anyone's got any questions, put them in the chat, but I'm going to steal the first one if that's all right. I know that when people have introduced physical activity programs within inpatient units, in particular in forensic units, that they see other anecdotal benefits. So reductions in like disruptive behavior and violence on the wards, and there's like more feelings of like more security, if you like, from the actual patients themselves on the wards. And what I wanted to try and work out is if you'd seen that. Now, I know you'd spoken about the relationships, and I know that when physical activity programs are introduced, that people can see improved relationships, not only just with the students and staff, but also family relationships, so that they extend beyond the ward. Anecdotally, if any of that is well.
One of our value of departments take part in the physical exercise, but also motivating some of the service users to attend. And I guess it's not just a case of kind of rousing them on a Saturday morning. There's work that's taking place during the week in order to
you've got to
get them
seed,
to,
haven't you?
Absolutely, and get also it's increased attendance from that ward by getting them to come in groups, so they weren't just kind of coming with a staff member. There was a few of them taking part, and all of them after the event said, "I'm so glad I got up and took part." The feedback from Emma, the anecdotal feedback from Emma, is on her ward that she'd noticed a reduction in the challenging management behaviours that they've seen, particularly for the service users who'd taken part. But I think, as I said, from the evaluation findings, the biggest impact had been on the improvement in those relationships with the staff who'd supported them to the event. Within our secure services, I mean, within health services generally, they can be quite hierarchical. Within our secure services, they can be quite hierarchical, and the feedback was both from service users and from staff that attending Guild Parkrun and taking part together had broken down some of those hierarchies that had existed and supported the formation of relationships at the same level, rather than those hierarchies that existed. And actually, when they're attending and when they're running, like some of the service users were running with staff, and they were like, "Come on, like catch up with me." So actually, when you attend, it doesn't matter who you are and whether you're a staff member or a service user. It's just the participation that matters, and encouraging each other as well while they're there. So that come on, come along with it in an encouraging way, not like can you catch me? So yeah. And forming relationships outside of the secure environment as well. Guild Lodge, obviously, like most secure services, will have an airlock as a perimeter fence. And what we've done is we've taken Guild Parkrun outside of that, to say on LSCFT land, but it's out in the open air, beautiful countryside, and so there's a level of normality to it as well, which you may not necessarily get access to if you just remain within the perimeter wall. Does that answer your question?
Yeah, totally. I'm going to move over now because I could ask loads and we could just talk all day and then no one else will ever ask any of their questions. So I think, Anthony, you've got your name up first. Your hand up first, not your name up first. Do you want to ask your question?
Oh, yeah.
Oh, sorry, it's just I can only see the Anthony bit, so sorry about that.
No, it flips my name round, so it's always surname first with the email. Thanks so much for a brilliant presentation. It was so interesting, and it's really great to see all these fantastic outcomes and how the momentum has been sustained over a long period of time. I had a question about staff engagement and staff support with these programs. I also do work in forensic inpatient settings, and often in relation to physical activity, and staff often say they don't have like the confidence, they don't have the knowledge to be able to promote and support physical activity. And it seems like there's been really brilliant staff engagement here. So I wondered how you initially approached that, maybe at the start of introducing the Parkrun, and then how it was maintained and sustained over time.
Yeah, so at the outset, we had the vision of we want to launch the first secure mental health parkrun. And we went through a series of processes, business cases, went to our execs for approval. We then drew in the exec, so it really helped having an exec buy into it from the outset, and as one of our senior kind of stakeholders. He also signed up to be the other event director, which I think has helped push the project forward from a senior level within the organisation. And then we got buy-in from other senior managers as well early on. And I think that buy-in at a senior level, they understood the vision, they understood what we were trying to achieve, has really helped drive the project forward and supported that, sustaining it. I think that there's definitely something. So as part of that, we developed a comm strategy. So I provided a presentation to all of the medics at Guild Lodge. This is what we're doing. This is what we're trying to achieve. I also provided it to senior staff at Guild Lodge. So it was trying to buy them in from the outset. We also created, as part of the comm strategy, a poster which went up in all service user and staff areas, promoting the event on the lead into it launching, and linked in with the OT and the physical health team as well to let them know what we were doing. So as part of their offer of physical activity, it would be, oh, what about attending Guild's Parkrun? And I mean, they needed to be involved in terms of the risk assessment and various kind of physical activity assessments prior to someone taking part at anyway. So they built in, as part of this, what about attending Guild Parkrun? And it was a case of, as well, communicating out that although in order to fully complete the course, that it's 5 kilometers like a mainstream event, but there's absolutely no requirement for people who attend to complete the full 5 kilometer events. So what we were finding was that you're welcome to come and just start off even doing one circuit and then build your way up from there. And we did find that some of the service users attended and they gradually built themselves up over time. So I think it's about really being clear from the outset with both staff and service users that this is open. It's not kind of rigid, you have to do the full 5 kilometers. It's about being together in the open outdoor fresh air countryside, and about forming the relationships as well that were there, that it's not just about the physical activity, it's about what it brings from a relational point of view as well. Did that answer your question?
Yeah, that's brilliant. Thank you. It's really interesting. And I guess it shows how important that top-down support is from senior management in like influencing the culture around physical activity and healthy lifestyle. So yeah, great. Thank you.
Justine, I'm just going to add a little bit to that as well, because what you mentioned in terms of skills, staff, knowledge, confidence, if you like, comes up again and again and again in the research that we've done. And one of the things I think is different here is the thing you said was physical health. And this is not necessarily physical health per se. You've got physical activity, you've made it a very normal subject. So I think this obviously will help. When I speak to staff, they don't really understand what's the evidence base to support people from their physical health. You train less more in mental health than in physical health. If you do get physical health training, it's usually much reduced in it's quite sort of skin deep, if you like. It's not very deep. And I think this is something that obviously impacts physical health, but it's an activity, and it's a very normal activity that takes place across the country. So it's more relatable. Whereas if you say to someone, yeah, we need to get you a comprehensive diet plan, your average person working in a mental health service will not be able to know how to put that together. But so this is a very different thing. It's almost like you've developed the thing and you're asking them to do it, if that makes sense. So, and I think, but yeah, we're going to talk a little bit more about skills, staff, knowledge, confidence, and the impact of working in mental health services on staff next month, because I'm doing the talk then. So I'll move over to you, Niall, next with your question. We've still got 15 minutes left, so we're doing well with questions.
Hi, can you hear me okay?
Yeah, perfect.
Yeah. So I also work in forensic services, and yeah, I think it's fantastic what you've done, and would love to be able to do something similar on our site. So just have a couple of practical questions. So how do you manage like confidentiality of patients with getting their results, and then also what does the route itself look like?
Yeah, absolutely. So how we deal with confidential service user confidential information is that when you sign up with Parkrun, you can either go a mainstream event, which is the vast majority of events across the country and across the world, are mainstream events. We've kind of replicated the model that they have within our prisons and young offenders institutions. So we've registered as a secure event. So when you register as a secure event, you then get access to the Parkrun website, like most other mainstream events can get. But within that, you can generate anonymous participation records. So you generate an anonymous random name, and that then links to a barcode. And from the outset, when service users attend, we provide them with that anonymized barcode, name and barcode, that they can then use to scan in. And to be honest, that we're dealing with relatively low numbers, so we're able to, if they forget it one day, if they turn up one morning and they've forgotten the barcode, we're able to link that service user with that record. We then keep a secure list of which service user is aligned with which anonymous participation record. The events are published, like all events, on the Parkrun website. So if you were to Google Guild Parkrun and then search in, you can access the results in the same way you can access mainstream events. But what it will bring up is that anonymized name. It'll still bring up the time. So service users are then able to access the website if they've got access to the internet, that is, and then able to access the Parkrun website and track the time like anyone else will be able to. We've not actually encountered it where then a service user who's taken part and has times and records on our Guild Parkrun website, where they then want to link it up with once they've been discharged to the community. So it is possible for them to either keep the same barcode and name when they move out to mainstream events, or they could just start in their own name at a mainstream event if they want to. There is a way that you can link that anonymous record with their own name, but obviously that would need to go through, depending on circumstances, I guess, a clinical decision making process about whether that's appropriate or not. So I think that answers the first part of your question, and the second was about the estates. So we're very lucky at Guild Park in that it's right on the outskirts of Preston, and we have a significant amount of land, which includes farmland and quite a lot of countryside. Within that, we have a project called Grow Your Own, which is where service users and volunteers go along and they support kind of horticulture. So they grow things and then sell it either on site, or they visit various markets. So what we've done is we've adapted some of the land that they've got, which already had existing paths, to host our Guild Parkrun on that site. So it's about a few minute walk from the nearest inpatient unit at Guild. They just walk down to the site and attend there. But as I say, it's all on LSCFT owned and managed land. Did that answer your question?
Yeah, perfect. Thank you so much.
Okay.
So I'm guessing that despite the similarity in surname, that you're not related, but you can always touch base with Mike as well, Niall, afterwards. I'd be interested to know if
yeah,
you did.
Definitely
Yeah, I mean,
will do.
obviously we're talking anyway about the resource that I'm developing, so I'd be interested to know if you do anything with this. It'd be really interesting to know. So Ita, over to you.
Hey, thanks, Mike. That was a really interesting presentation. I think, well, first of all, it's inspired me to look at my local park run. I've kind of half signed up for it 5 times and then bottle it for some reason and don't go. But I think it's a really important initiative as well, isn't it? Because it combines so many important aspects in terms of people sticking with physical health interventions, which is that sense of community as well, that sense of progress, achievement. One thing that I have 2 questions, if that's okay. The first I wanted to ask about, and I know it's something that has come up for me a lot in relation to when I've been doing research on pharmacological interventions to manage antipsychotic induced weight gain or kind of obesity more generally in the context of severe mental illness. But I've seen it a lot in discussions around non-pharmacological interventions, and this is around equity of access. And now, forgive me, I'm obviously joining from the Republic of Ireland, so the setup of our systems might be a little bit different, but my understanding is the UK is kind of similarly risk averse to how we are in the Republic of Ireland. But I was wondering, with regards to access to this, you said about risk assessment and people attending and things like that. Is it the case that people obviously who are more severely mentally unwell are more adversely impacted by that mortality gap that you mentioned? Is it the case that you had people attending that came from the spectrum of illness presentations and associated risk, I suppose, with people attending these things? Was it people who are more mildly unwell, or is it something that people within secure services can access in terms of equitable access? Did that make sense, that question?
Yeah, so I guess to be clear from the outset, and I think this was one of the dilemmas when we were setting it up, particularly on a secure site or on the outskirts of a secure site. We were conscious that not everyone would be able to attend due to their level of acuity, their risk history, or there may be physical health difficulties, reasons that because of a risk assessment they're unable to attend. So we were very clear about that there's various kind of processes we advertised the initiative, and as I say, it's been promoted through our OT teams. The process is the service user would attend their MDT or speak to the OT and say they would like to attend. They then have a mental state examination, assuming that the MDT are in agreement with them being able to attend, and I guess whether because it's classed as being in the community, so service users who attend independently either have to have all of the necessary risk assessments in place to secure Section 17 community leave, or for those who require an escort, the inpatient team will provide an escort for some service users who want to attend. So the process is they ask can they attend, assuming that the MDT initially agree. They'll have the mental state examination, which would take place there, but it'll also take place fluidly, so prior to them attending on the day. All of our service users have standard risk assessments in place. All service users at Guild Lodge have enhanced risk assessments in place. So whether they are HCR20s or RSVP assessments, formulations will be in place for them as well. So from a mental health perspective, that will have thoroughly been assessed. Their physical health would also need assessing prior to them getting approval to attend, and also an assessment by our OTs as well. So that holistic assessment then goes to the MDT, and then they agree whether the service user is able to attend independently using Section 17 leave, or whether they require an escort. Did that answer your question?
Yeah, I know you mentioned about top-down support. Did you get much pushback from clinicians, as in the psychiatrists, with regards to, you know, the kind of general appropriateness of doing this in a secure setting? Or I imagine it was a significant kind of change. I'm just thinking about now, if I went to the consultant psychiatrist in charge of our own secure unit, I can imagine there would be a little bit of a really, you know, that kind of way. Even though I completely agree with what you did, I just imagine it would be quite a cultural shift in many cases. Am I wrong?
That's a really good question. Yeah. I think so. Some of our services, it can be really challenging, and I think when we've proposed such a significant change, which is a change to potentially kind of impacting on how they manage security, how they manage people's physical and mental health, and also such a kind of challenge to the culture, then yeah, I guess it's quite natural for that to be a challenge. We've been really fortunate in that from the outset. So as I say, I presented to the consultant psychiatrist as part of this is what we're proposing, getting them to buy in from the outset. We've actually had some of our consultant psychiatrists attend some Guild Parkruns, which has been really good, alongside service users who they support at Guild, and so that's really helped as well. I think like all these kind of initiatives, and as you say, people registering for Parkrun and then not taking part. It's not, we get that it's not everyone's bag, particularly getting up first thing on a Saturday morning and coming along when the weather is like it is in Lancashire today, grey and overcast. And we absolutely get that, and that will be the same kind of reflection across our staff team and consultant psychiatrists. But so absolutely get it and see the worth in what we're doing. Did that answer your question?
It did, yeah. I suppose just because there's no other anyone's hands are not raised at this stage. Apart from implementation, or sorry, apart from top-down support that you mentioned, just because I'm conscious that there are people joining from different settings, including Ireland, Finland, is there anything else you would recommend in terms of any other kind of top tips with regards to what was successful in terms of implementing this, apart from the top-down support? Is there anything else you'd say that was really important?
I think top-down support, funding. So you need to secure funding for the event, which from the outset I was lucky. I was able to secure that from our NHS charitable fund. I think the setup costs were around £4,000 to register with Parkrun, but that is a lifelong cost. So you pay once, and then you get all of the apparatus, including the pop-up that's on there and the various kind of flags that you get. Your course equipment like your cones, things like that, and then access to the Parkrun website and their digital management system as well. Once you've paid that one-off fee, it's then ongoing for forever potentially. So yeah, I think it's about securing. As I say, one of the challenges was landowner permission, which became a challenge for us after 6 months. And my understanding is that this is a national challenge. So I think parkruns are often being proposed, but then it comes down to who's the landowner and are they going to give permission for X number of people to turn up on a Saturday morning and run or walk or whatever it may be. And I guess it's not just about that, it's about the traffic that it can potentially create and the car parking situation. So my understanding is that that they're one of the biggest challenges for people setting up mainstream parkrun events. So if anyone's thinking about doing it, I'd just consider who the landowner is for the site that you're proposing. The risk assessment side of things, in terms of risk assessment with Parkrun and risk assessment with our organisation, is relatively straightforward, and Parkrun, as part of the fee that you pay, Parkrun provide the liability insurance as well for those taking part, which was a big kind of benefit for our organisation as well. So yeah, they would be my top tips.
That's brilliant.
That's great. Thank you for a really valuable presentation. It looks great, and I imagine like that you face a lot of barriers, so good for you. Really important initiative.
Well, we've got a couple of minutes left, probably just under, so we've got time for one more question, which is lucky because we've got one more hand. So, Anthony, do you want to ask your question?
No, thank you. I think it's fantastic what you've done, Michael. It's been a really good presentation. It's really kind of, I'm a regular park runner on a weekend, so I can fully kind of acknowledge the benefits of it. And there's a group of us kind of travel around doing the A to Z and things, so it's a fantastic movement. I just wonder, in terms of, obviously you've gone into secure care, and that's probably the most challenging in terms of rehab wards and other community teams. And do you get a sense that people are running other events, in the patients in community teams and service users, or are you getting other sort of areas interested in terms of like the rehab wards where service users have that a bit more freedom, I guess, if you like?
Yeah, so the pathway for service users at Guild Lodge is that they wouldn't normally step into rehab. They would normally step out into the community. So no, we've not engaged with rehab services. As I say, as part of the learning from the evaluations that we've done and from the entire project, I am linking in with various SLTs around our organisation to look at setting up other parkrun events. So one of our largest acute hospital in Blackpool has land around it, which we are scoping to set up a parkrun event there. I think what will be important, and I guess learning lessons from this one, is about drawing in VCFSE organisations and the local authority from the outset, so that service users who attend, and I guess there won't be such a static service user population there, and that the turnover is higher, length of stay is shorter. So I think it will be important for that group, those who take part, that there's a pathway and some support, so when they are discharged out into the community, that they've got support around them to be able to attend whatever local event it is, mainstream event that is near them, assuming that they want to attend that. Did that answer your question? I'm just conscious of the time as well.
Yeah, it did. Thanks, Michael. Yeah, that was great. Thank you.
But if anyone's got any questions or would like any further information about what we've done, just absolutely send me an email and I'll set up a meeting, and I'm willing to talk through it with you.
One of the things I was going to say, Mike, is it might be worthwhile for the people who couldn't make it today, because I know Friday can be a tricky day for some, is if we can also maybe move some of the discussions over to the JISC mail list as well, so then other people can maybe join in, and it might increase the number of people who are interested. And obviously then, yeah, everyone can then contact you independently. But if we've got some generic questions, it could be that it could open up a bigger platform for other people to get involved, because I think we do need more ideas about what can we do in our respective sessions. Services. So thank you very much for everyone for logging in on a Friday. It's really nice to see you all. Hopefully we'll see you next month. And once again, I want to say thanks to Mike, and I'll be hanging around for a couple of minutes if anyone's got any specific questions. But thank you very much. It's been a fantastic presentation, Mike. Thank you.
Thank you. Bye now.
Bye.
Thank you. Bye-bye.
Bye.